Hockin, Michigan's grant writing workshop webinar for our 2018 and 2019 community grant cycle. This presentation is intended for the community grant application, not our small grants. If you have any other questions regarding our small grants, feel free to reach out to me, Sarah Hockin, the mission director, at shockin@colemanmichigan.org. All right. First, we're going to be talking about a little background of Susan G. Komen, Michigan, and Susan G. Komen, our national headquarters. We'll give you an overview of our community grants process and the community profile and funding priorities, and go over the 2017 request for application for the 2018-2019 grant writing cycle. And then after that, there will be some updates to GEMS, which is our computer management system, and a grant writing tutorial as well for those of you who might be new to writing grants. So about Susan G. Komen, we are the world's largest breast cancer organization. Aside from the federal government, we are the largest funder of research for breast cancer. We have funded over $920 million in research, has provided more than $2 billion in funding screenings, education, treatment, and psychosocial support programs serving millions of people in more than 30 countries worldwide. It was founded by Nancy G. Brinker, who promised her sister, Susan G. Komen, that she would end the disease that claimed Susie's life. In 2016, Susan G. Komen set a bold goal to reduce the current number of breast cancer deaths by 50% in the U.S. before 2026. The purpose of our community grants is to increase access and utilization of quality care to reduce late-stage breast cancer diagnosis and help reduce breast cancer mortality. In order to access progress towards our bold goal, and in keeping with the purpose of community grants, which is increasing access and utilization of quality care to reduce late-stage breast cancer diagnosis and mortality, Komen is interested in collecting information on applicant grantee accreditations as a measure of quality of care. For the same reasons, Komen is also interested in fiscal year 18 grantees reporting on time of care, which is measured in days, such as the number of days from abnormal finding to diagnostic resolution, the number of days from diagnosis to beginning of treatment, as well as the stage of diagnosis and completion of care. Only those grantees, of course, who have objectives related to following patients throughout the continuum will be required to provide this information. So a little bit about Susan G. Komen, Michigan. We are the result of a merger of 3 separate entities in the beginning of 2015. We took 3 former service areas of West, Southwest, and Mid-Michigan and combined them into the first Susan G. Komen affiliate in Michigan. It began in 1996 originally as a race for the cure in Battle Creek. As this race evolved, it became Susan G. Komen Southwest Michigan and expanded to the surrounding 7 counties of Allegan, Berrien County, Branch, Calhoun, Cass, Kalamazoo, St. Joseph, and Van Buren. Not long after, the first Grand Rapids Race for the Cure was held in 1998, and an affiliate was incorporated in 1999, encompassing the counties of Kent, Ottawa, Muskegon, Newaygo, and Montcalm. As word of Komen's work spread across Michigan, what would eventually become Komen Mid-Michigan was established in 2001 to serve women in the counties of Clinton, Eaton, Ingham, Jackson, Livingston, Shiawassee, and Washtenaw counties. Now serving 24 counties after the addition of Hillsdale, Ionia, Berry, and Mecosta counties in 2016, Komen, Michigan is run by 7 full and part-time staff and countless dedicated interns and volunteers, continuing in the mission to end breast cancer forever. Through events like the Komen, Michigan Race for the Cure, Komen, Michigan has invested more than $12 million in community breast health programs in 24 counties and has helped contribute to the more than $920 million invested globally in research. The continuum of care will be referenced in our upcoming RFA, and it is important to understand what this is. This talks about gaps that the continuum of care may. Oops, sorry, I lost my place here. It talks about gaps that the continuum of care may expose the patient to, and we don't, of course, want to fund screening programs in case women do not know about all of the opportunities. But the affiliate isn't funding any education and outreach programs. How will that patient actually receive the knowledge of getting screening and diagnostics? On the other hand, if we're not funding screening and diagnostic programs and only screening or only funding education and outreach projects, there isn't any location then that would be able to help catch the patients that need treatment and need access to care. Of course, this kind of depends specifically on the service areas that you are applying for your grants. The local resources and programs within each individual county and different services are vary greatly amongst our service area. Now, a little bit about our community grants process overview. The community grants process is rooted in our community profile. Every 5 years, the affiliate conducts an in-depth look at the breast care needs in our service area. Based on the findings of the community profile, the affiliate then develops funding priorities for our grants program so that we can best serve those most in need of breast health services. These funding priorities become the basis of the RFA, and the affiliate works to identify potential eligible applicants. Part of the solicitation process is the training that you are participating in today. The affiliate's goal is for a wide range of high-quality program applications to present to our review panel. This enables the affiliate to have confidence that the programs selected for funding are in fact the most impactful. In order to help applicants develop proposals that will meet the needs in our community, we host this workshop. Applications are then reviewed by an independent review panel comprised of experts and representatives from the community. The review panel develops the grant slate that is then presented to the affiliate board of directors for formal approval. The affiliate then awards grants for the upcoming year and begins a process of active management and monitoring of each grantee's progress toward their objectives. If you have any further questions about the community grants process overview, we do also have more information on our website at cohenmichigan.org. Here are a list of a few of our important dates. On September 11th, 2017, the application will be available in our grant management system, GEMS. Later on in this webinar, there will be information on how to access GEMS as well. The initial grant application submission deadline is October 9th, 2017. The week following October 9th is our compliance review period. And if there are any issues within that review period that come about your application, I will then notify you immediately. And the modification deadlines, if there are any needed modifications to your application, is October 30th. The month of November, our grants will be reviewed. And January 9th is when the grant slate, the final grant slate, is presented to our board of directors. Tentatively, March 2018 is when our award notification process begins. This varies depending on our fundraising throughout this current fiscal year, which ends March 31st. We will then initiate our contracts as soon as the award notification begins. And then October 1st of 2018 is the 6-month progress report, which is due. And then once that report is approved, the second payment after the initial payment has been completed and expended will be issued. November of 2018 will be scheduled site visits within all of our large grantee recipients. And then March 1st, this is important, is a deadline to request a no-cost extension. We cannot have any extensions granted later than 30 days prior to the end of the grant term. May 15th is when the final report of 2019 is when the final report and return of any unspent funds are due. Now, a little bit more detail about our community profile. The community profile is an assessment of breast cancer and breast health services within the community that we serve. It is designed to ensure effective and targeted efforts and is collected through rigorous analysis of data, through focus groups, and through research done by a team and panel of experts and members of the community. For results of our community profile, that also can be found online at colemanmichigan.org. So this most recent community profile was created in 2015, and they have determined from that community profile that there are 3 target funding priorities, which are listed above or on the screen in the order of importance. Screening and diagnostic access are evidence-based programs that provide access and reduce barriers to breast cancer screening and/or diagnostic services. Examples of these include clinical breast exams, screening mammograms, diagnostic mammograms, ultrasounds, MRIs, biopsies, mobile mammography, transportation assistance, expansion of clinical hours, and copay or deductible assistance. Next is culturally appropriate education and community navigation. These programs are community-based navigation programs focused on connecting women to screening services and providing referral and supportive transition to follow-up services, such as diagnostics and treatment. Programs should reduce barriers to care and provide evidence-based community education that dispels myths and reduces fears. The focus is bringing healthcare into the community and increasing the number of women who have not been screened in the last 2 years who receive screening and services. And finally, the survivorship programs. We like to fund programs that develop new or strengthen existing evidence-based survivorship programs that address life after the cancer diagnosis. Programs must include lifestyle interventions, which are specific to breast cancer survivors, which reduce the risk of a late-stage cancer recurrence, thereby reducing mortality rates. They should place an emphasis on social and emotional well-being, wellness programs, and lifestyle intervention strategies. All of these programs must address the target communities, such as African Americans, primarily in the Berrien County, Jackson County, and Muskegon County, Hispanic and Latino communities, which are often found in Kent, Ottawa, and Van Buren counties, and rural counties, such as Cass, Montcalm, and Livingston. It also is important to note that programs that provide screening and/or diagnostic services are eligible to request funding of up to $60,000. Any program that does not provide screening or diagnostic services are eligible to apply for funding up to $30,000. These caps are designed because screening and diagnostic services are much more expensive and are also a greater priority currently. Next, we're here to talk about our evidence-based practices. They have been shown through scientific research to consistently improve measurable outcomes. Instead of tradition, gut reaction, or single observations as a basis for making decisions, evidence-based practices have been shown through scientific research to consistently improve measurable outcomes. This may seem like a big jump, so what does this mean for us? We want to fund programs that matter, that make a difference, and that use evidence-based practices that ladder up to our bold goal. Because these will be the programs modeled after those that have been researched and shown to be effective in achieving their desired outcomes and ultimately saving a life. Evidence-based practices can be found in these three different areas. The Community Guide, which is a resource designed to assist organizations selecting programs to improve health in their community. The Community Preventative Services Task Force conducts systematic reviews of interventions and make recommendations for their implementation based on their findings. The National Cancer Institute's research-tested intervention programs is a searchable database of cancer control interventions and program materials. It is designed to provide program planners easy and immediate access to research-tested materials. Finally, Cochrane Reviews. It's an organization that gathers and summarizes the best evidence from research to help individuals make more informed healthcare decisions. Now, also listed in our RFA is our eligibility requirements. The full eligibility criteria is listed online in our RFA, which can be found at colemanmichigan.org, and this currently has just been condensed for presentation purposes. Individuals are not eligible to apply. Only nonprofit organizations with a 501c3 status or a governmental organization with a 170c1 status serving residents of Allegan, Berry, Berrien, Branch, Calhoun, Cass, Clinton, Eaton, Hillsdale, Ingham, Ionia, Jackson, Kalamazoo, Kent, Livingston, Mecosta, Montcalm, Muskegon, Newaygo, Ottawa, Shiawassee, St. Joseph, Van Buren, or Washtenaw counties are eligible. These requirements must be met at the time of application submission. We also allow the following expenses. It must be noted that indirect costs are not to exceed 15% of the direct costs. And also, we are not able to fund equipment, including software, over $5,000. Some of our funding restrictions and things that we cannot fund are research, education regarding breast self-exams or the use of breast models, development of educational materials or resources that either duplicate existing Komen materials or for which there is not a demonstrated need, and education via mass media, health fairs, and material distribution. Again, this is not an exhaustive list. The full list is also provided in our RFA. And some more condensed lists of important grant policies. The project must occur between April 1st, 2018 through March 31st, 2019. It must be noted also that while the contracting process can take up to 6 weeks, no expenses may be accrued against the grant until the contractual agreement is fully executed. Grant payments will be made in 2 separate installments, pending compliance with grant agreement and receipt of satisfactory progress reports. You also may request one no-cost extension of up to 6 months per grant, no less than 30 days prior to the end of the grant cycle. We also do require our grantees to have insurance if awarded. You must provide a certificate of insurance during the contracting process. The grantee is required at minimum to hold the following different coverages. All of our proposals must be submitted online through GEMS at the listed website. That is affiliategrants.komen.org. The applications must be received on or before October 9 at 5 p.m. for compliance review. Don't forget that submission is a 2-step process. First, the project director completes your application and changes your status to authorized signer required. Then, the authorized signature of your organization must then log in and officially submit the application. Make sure you allow time and monitor the authorized signer's schedule to ensure that they are able to submit the application before the deadline. From our RFA, this is also condensed. We only fund programs that use educational messages and materials that are consistent with Komen messages. You can view, download, and print all of our educational materials by visiting komen.org. If you intend to use other supplemental materials, they must be consistent with Komen's messages, and if Komen's logo is featured on these materials, they must be approved prior to printing and distribution. Please remember that Komen will not fund any education programs that teach or endorse the use of monthly breast self-exams or use breast models. We will only fund breast self-awareness and know your normal messaging. Now, a little overview of the application itself. First, within the project narrative, it will include a statement of need, which describes evidence of the risk or need within your identified population. Be sure to describe the target population to be served using race, ethnicity, socioeconomic, and breast cancer mortality statistics, and describe how this project aligns with the RFA funding priorities. Next is our project design. Describe how the project will increase the percentage of people who enter, stay in, or progress through the continuum of care, and thereby reduce breast cancer mortality. Be sure to explain what specifically will be accomplished using the Komen funding and how the project's goals and objectives align with the selected funding priorities. Explain how the project is designed to meet the needs of specific communities and reflects the cultural and societal beliefs, values, and priorities of each community. Next is the organizational capacity. Explain why the applicant organization and associated project staff are suited to lead the project and accomplish the goal and objectives. Be sure to include appropriate organization or staff licenses, certifications, or accreditations. Describe evidence of success in delivering breast cancer services to the proposed population. If the breast cancer project is new, please describe relevant successes with other projects. Next is monitoring and evaluation. Grantees will be required to report on the following outputs and outcomes on the progress and final reports: accomplishments, challenges, upcoming tasks, lessons learned, a compelling story from an individual that was served with Komen funding, demographics of individuals served through Komen funding, and the monitoring and evaluation narrative must also address the following items. Describe how your organization will measure progress, which includes the specific evaluation tools that will be used to measure progress. These can include client satisfaction surveys, pre- and post-test, client tracking forms, or etc. You must also be able to describe the specific outcomes that will be measured as a result of proposed project activities. This can include the number of days to diagnostic resolution after an abnormal imaging test, the number of days from diagnosis to first day of treatment, or etc. And finally, describe the resources and expertise available for monitoring and evaluating during the project period. Next, we like to look at the collaboration of community partners. We expect that you will identify any stakeholders or non-traditional partners and collaborators that may connect your clients or patients and would otherwise support the program. You can submit up to 3 letters of support to describe how well your program will provide or strengthen community collaborations. If your organization is requesting funds for screening or diagnostic services, we need to know also what your present relationship with other sources for breast health services, including the Michigan Breast and Cervical Cancer Control and Navigation Program and the Healthy Michigan Plan. Please describe how your program design will connect those who qualify with the BCCC-NP and Healthy Michigan Plan programs. Finally, your application will be measured with sustainability. You are to describe how your program will be able to sustain itself in perpetuity without guaranteed grant funding in the future, allowing for the continuation of the program's mission. You are to explain how outputs produced during the grant, a new curriculum, etc., will continue to support operations of both the program and Susan G. Komen's mission. Describe any changes in policies or internal structure during the grant timeline that will improve efficiency and effectiveness or the operation and support sustainability. We also would like to know what other sources of funding are secured for the specific project. Are these funds guaranteed for a specific amount of time? What is the long-term value of the proposed program after awarded? New this year, because of Komen's bold goal, there is one universal goal already instilled into your project work plan. It is to reduce breast cancer mortality by addressing disparities, increasing access to quality and timely care, and or to improve outcomes through patient navigation. While there is no limit to the number of objectives allowed, the number of objectives should be reasonable, with each able to be evaluated. The objectives should only be included for the proposed work to be achieved using Komen funding. Also listed within our RFA is a tool on writing SMART objectives that also can be found on komen.org/writing SMART objectives.html. Also included as a reporting on objectives. For each individual objective that is created in your application, you as a grantee would report back on the key accomplishments, the upcoming tasks, and program challenges. If an application creates 5 objectives, they will report back 5 times. Here are some examples of different objectives. By February 1, 2019, the patient navigator will have contacted 100% of all women with an abnormal screening result in Greene County within 3 business days to schedule a follow-up appointment. Objective 2. By March 31, 2019, the project will provide 30 uninsured or underinsured Greene County women with free or reduced cost diagnostic procedures within 30 days of an abnormal screening. For additional examples and a SMART objective checklist, please refer to Appendix B within our RFA. There also will be new reporting metrics, which is found in Appendix A of our RFA. We require all grantees to report on demographics of those that are served. Each option in the service list on the project work plan page of the application will have a corresponding customized page in the progress and final report. There are 7 possible customized report pages in each progress report and final report. That includes education and training, screening services, diagnostic services, treatment services, treatment support services, barrier reduction assistance services, and care coordination and patient navigation or case management. If awarded, you will only see report pages that correspond to the services that have been selected in your application. If your application was selected barrier reduction assistance and diagnostic services, you will then see reports featured on this slide and the next. Here's the barriers reduction and diagnostic. Each service does have varying data to be reported. For a full list on the fiscal year's 18's reporting metrics, please be sure to look at our RFA again. Next is how you will build your budget. The budget will include key personnel and salaries, consultants or subcontracts, supplies, travel, patient care, other, indirect, and project budget summary. Direct patient care services, even if subcontracted, should not be included in the consultants or subcontract section. Those funds should still be included in the patient care budget section. This patient care budget section is new because it now features drop-down selections for 4 separate areas, including screening, diagnostic, treatment, and transportation. You will now see that the costs are broken down to make it easier for users to determine how many services are proposed and how to ensure alignment between the work project plan and budget. The patient care costs will also include all services for patient care except for translation services. Translator services should be included under consultants or subcontracts if the grantee is working with a specific individual or organization who is not a staff person. If the translator is a staff person, please include the cost under key personnel or salaries. This information helps the reviewers determine the amount of support the organization is providing toward the program beyond simply relying solely on Komen funding. Explain how this speaks to the long-term sustainability of the program and the value that the organization and senior management see in the program by investing resources into this. All cash would be any monetary funds for the program from outside sources, such as other grant awards. In kind means both services and supplies provided by the organization itself and from outside sources to support the program. We also require the following attachments at time of submission for the RFA. Letters of support or memorandum of understanding, which is attached on the project profile. Any resumes or job descriptions of relevant personnel, and that will be attached on the key personnel and salaries page in GEMS. And proof of tax-exempt status, which is found on the project budget summary. Now here are the percentages that our affiliate has opted to weigh for each category. Impact is how successful will the program be at increasing the percentage of people who enter, stay in, or progress through the continuum of care, thereby reducing breast cancer mortality, is 20%. Statement of need is 15%. Project design, 20%. Organizational capacity, 15%. Monitoring and evaluation, 10%. Collaboration of community partners, 10%. And sustainability, 10%. These percentages all add up to 100% and will be the weighed scores of all the different reviewers' ratings. The review scoring anchors include 7 to 1, with 7 being exceptional, 1 being poor. The reviewers will use this scale to determine all of the different former review criteria, which is stated on this page here. The review process is a compliance review. It comprises of a compliance review, which is done by me, the affiliate staff, and also if we have a grants committee, which the Komen, Michigan location does not. This will ensure that applications adhere to our RFA requirements. Again, that review process runs from October 9th through October 16th. Once they have been completed and any updates have been made to the applications by October 30th, the review panel then is presented with the applications. This is comprised by a group of members of the community, between expert reviewers who are professionals and have experience working in breast cancer or public health, including patient navigators, medical professionals, public health officials, and academics or educators, and community reviewers, which include survivors and or members of the target population or community. It is diverse, representing our different cultures, different racial and ethnic groups, geographic areas, professions, and life experiences. A minimum of 3 review panel members will score each application. They must score the applications against the ideal application rather than scoring the applications against each other. Once that is complete, the review panel meets to discuss the grant applications and to determine the slate of projects to present to the affiliate board of directors. Then in January, the board of directors will vote to approve the grant slate. If the grant slate is not approved by the board of directors, it is then presented back to the review panel members, who then reevaluate and reassign the slate to be then presented back to the board of directors. This process repeats until it's been completed and approved. Next is a brief grant writing tutorial. Again, this is a presentation that is intended for community grant applicants, but not small grants. Many communities have a local center for nonprofit management, libraries, or other organizations that also provide grant writing workshops. If time allows, consider developing a relationship with one of these groups. It is important first when you're planning your proposal to read everything. The RFA and the community profile, which are both linked on our website, and you will also find that linked below at the end of this presentation. And then also consider your funding priorities carefully. You are to discuss your ideas with decision makers within your organization and explore opportunities for collaboration. It's important to work across your departments to develop your proposal and not work in a silo. Also, it's important to start early. Allow time to craft an innovative application that is truly responsive to the identified needs in the community. The proposal abstract is a brief summary that not all reviewers may read. It is a first impression, though, which is very important, in a brief statement of your case and a summary of your proposal. Be sure to be compelling and concise, and do not exceed more than 1,000 characters. The abstract should include specific details that are within GEMS that are listed in our website. Also, the need to be addressed by the project, a description of key activities that will be funded by Komen, the target community served, the expected number of individuals served, and the expected change the project would likely bring in the community. Next is your process evaluation. You want to evaluate throughout your process what exactly happened, how it happened, how much it's going to cost for you to do the project, where you will complete the project, and who is your target community. You'll also want to evaluate your impact. You want to look for changes in behavior, knowledge, attitudes, and beliefs. It's also important to list the goal changes among individuals, providers, organizations, and communities. The toughest thing that I've ever found with writing a grant is within the budget. It's important to remember that projects become a reality because the central idea is sold, not because the proposal is cheap. It's important to be realistic and ask for what you need within the grant limitations. And it's also very important to justify your expenses. The stronger justification that you can provide, the better that the grant application is received. Reviewers do not simply look at the bottom line, and they understand it isn't enough to simply fund mammograms at the very lowest cost. Increased costs for outreach and patient navigation are often also critical to the success of guiding underserved individuals through barriers to care. In summary, make sure that you read the request for application very carefully and follow all directions. Grant reviewers like to see applications that are innovative, realistic, specific, and are written clearly using an active voice rather than a passive voice. Be sure to avoid jargon or acronyms as each reviewer may not be breast health or medical professional related reviewer. Yes, they will receive training, but they will not be familiar, or they may not be familiar with terms like EHR, CAD, or CAD, etc., NCI, or MQSA. Applicants should not take for granted that reviewers know details about specifics of the disease. For example, lymphedema, the specifics of cancer staging, breast density, etc. Be sure to include a brief description and write for a layperson, a non-medical audience. If you have any questions, please be sure to contact me, Sarah Hockin, the Mission Director, at 616-752-8262, extension 2016, or at shockin, SHOCKAIN, at colemanmichigan.org. Also, be sure to use the GEMS applicant manual, which is found on our website as well, to guide you through all of the steps of the application process from registration all the way through application submission. Please also be sure to allow for plenty of time for responses. There are many times where I may need to contact Komen headquarters for support, and sometimes it may take a few days to receive a response. Next are some updates within our GEMS program. This is mostly intended for those of you who are already familiar with GEMS. They've done some enhancements that I'm actually a little relieved to see. Komen has invested in upgrades to the system based on feedback from our affiliates, grantees, applicants, and reviewers, hoping to make the system more user-friendly for all. These changes will save users time, make it easier to access information in the system, and eliminate many of the clicks it currently takes to navigate to pages in GEMS. We have also taken care to update the application pages to make them more streamlined and to help boxes that have been added to provide guidance to applicants. With a widescreen view added to GEMS, you no longer need to scroll horizontally on pages. I certainly hope that this change makes it easier to enter information. I will also include a link to take you to the grantee-specific GEMS training, which will demonstrate enhanced navigation, and the new application snapshot page. The enhanced navigation is a key change that will make it easier to move through the system. Once you select an application, you will be able to easily maneuver between pages by hovering over the Forms menu, and to change the status of any page by hovering over status changes. You can now click on any page name to access that page within your application. There also is a new page called the Application Snapshot page. It provides a glimpse of key information related to the application, including grantee contact information, current grant status, your progress, and final reports associated with the grant. Users will no longer have to click through to different pages to find this information, and it will be easy to find in one place. That is all for you today. Again, if you have any questions, please feel free to reach out to me via email or phone. And good luck. Thank you.